Good evening, everyone. We're all welcome to today's program. Um, it's nice having you again today. It's another day for an hour with the cardiologist. It's the 24th of November, 2024. We will wait a bit. Thank you for showing up on time. Let's give about 2-3 minutes for others who are in the waiting room to be admitted in. While we are waiting, you can kindly reach out to friends, colleagues, those that you have been invited, and remind them that we are starting in a few minutes from now so that they can also come in and benefit. Thank you very much. Okay, good evening, everyone. Thank you for joining us once again. I think we will start. It's 7 minutes after 9, after 7, and we will just start. I think those that are in the waiting room still trying to come in will join us. Um, it's an interactive session. It's an hour with the cardiologist. For those of us who have always been here, we welcome you again. And we want to believe that it's going to be a very interactive and a very, informative session. We also want to believe that you will get value for your time. For those who are joining us for the first time, we welcome you and we believe that you will not regret joining us. We want to welcome everyone once again. This meeting will be recorded, and then after the meeting, we will post the recorded version on the WhatsApp platform. So if you are not on the WhatsApp platform, you can let us know later on, a number will be sent to the chat box. You can copy that number after the meeting. You can, send a message to the number, and then you will be added to the WhatsApp platform so that once it's posted, you will be able to access it again. So once again, you're welcome. It's an hour with the cardiologist. Today is the 24th of November, 2024, and I believe it's going to be a wonderful time together. We're also streaming live on YouTube and on Facebook. The links will be sent to us. You can send them to those who might be finding it difficult to join us on Zoom. Okay. Having said that, we are starting immediately. I want to say thank you to everyone. Welcome, Dr. Donye. Welcome all the doctors and all the medical personnel in the house. Welcome to everybody that have taken our time to join us. We really, really appreciate you. And I believe that it's going to be a very good time together. And I also want to welcome a friend, a very dear friend of mine, Dr. Onyeka Shitu. I can see him there. He's based in Australia, and he's with us today. I'm sure that after everything, he will have, some, minutes to talk to us, and then maybe just share one or two things with us. Dr. Onyeka Shitu, you're welcome. God bless you. Fine. So let us start. We're going to be looking at tips for a healthy heart, part 3. We looked at part 1 in part 2 weeks ago, and today we'll be looking at part 3. I'm Akesanya Olusegun Joseph, and we will delve in immediately. So, like we've always said, and I'm sure that a number of us that have been on this platform, at least for the past 2 editions, may be able to recite this by heart. 80% of causes of cardiovascular disease are preventable by cultivating healthy lifestyle behaviors. This is very, very important. What this means is this: you have a lot to do with your cardiovascular health. I have a lot to do with my cardiovascular health. I have a lot of responsibility to make sure that my cardiovascular health is optimal. Very, very important. 20% we may not be able to control, but as far as we know, 80 is far more than 20%. And so there are a lot of things we can do to make sure that our cardiovascular health is optimal. And not just our cardiovascular health, our entire health really, because your cardiovascular health will impact on every other, system and organs in your body. So it's extremely important that we know this. And knowing this should make us to be very, very intentional that I am going to give it all it takes to make sure that, I live a very, very optimal life as far as, cardiovascular health is concerned. I will choose responsibly. I will act responsibly. I will respond responsibly in terms of, behaviors, okay, and choices, okay, that will increase and improve our cardiovascular health. Today, we're going to start with smoking. Yes, smoking. So it is important for us to know that smoking is still very, very deadly and very dangerous. All right. And we need to be, very, very intentional about that. Yes, a number of us on this platform may not be primary smokers, but you know what? Secondary smoking is as dangerous as primary smoking. And I want us to focus on that a bit. Yes, we're going to be talking to primary smokers as well, but let us be well assured that secondary smoking is as bad, if not worse, than primary smoking. What is secondary smoking? Secondary smoking is, inhaling, okay, the cigarette smoke of a smoker just beside you. You hang out with a smoker, the person is smoking, and you are, innocently, in quotes, just there interacting with him or her. You become a secondary smoker. All right. And it is very, very dangerous. Okay. There are also tertiary smokers, but let's limit ourselves to secondary. Secondary is, as dangerous as the primary smokers. Another example, you are in the same car with somebody who is smoking, and the whole thing is, the windows are up because the AC is on. That is secondary smoking. It is dangerous. All right. Or you are in the elevator with somebody who decides to walk into the elevator with his cigarette, on, and both of you are in the same elevator. That is secondary smoking. You are a candidate, so to speak. You become a secondary smoker, and that is injurious to health. Whatever primary smoking does affects secondary smokers as well. Whatever affects primary smokers affects secondary smokers as well. So it's extremely important that we know that. There's also tertiary smoking. Tertiary smoking are those who walk into, a room or a place where a smoker had left, and the whole thing is settling but not completely gone. So a, a smoker just entered an elevator, gone upstairs, left the place, and about 3, 4, 5 minutes later, another person enters that elevator, and it's still the smell is still there. Not as skunk as, directly taking it in as the person, as if, you are with the person directly, but it is still there. You can still perceive it. That person becomes a tertiary smoker. The risk is a bit lower, but the best for us all is to avoid all forms of smoking, whether active or passive. All right. Very, very important. Now, let's look at what the, smoking does to the heart. This is something we've got to, examine, something that is very, very important for us to examine. Okay. Smoking will not only affect your heart, it will affect the blood vessels. Okay, so it increases the buildup of plaques, okay, in the blood vessels. And when plaques come in, what happens is that there will be, blockage of, flow of blood to the various parts of the heart. And we need to be very, very, conscious of this. Okay. Now, when that comes in, the person can eventually come down with what we call heart attack. It causes not only build up of plaques in the blood vessels, it causes thickening and narrowing of blood vessels. So there is vasoconstriction of the blood vessels. The blood vessels becomes thickened and narrow. Okay, and that is not good as well for the and that is not good as well for the person. So it's extremely important that we know this. Smoking is something that we need to deal with. So it can quickly affect the heart and the blood vessels, causing heart rate to rise almost immediately. Smoking will make the heart rate to rise. And when the heart begins to beat very, very fast, what it does is to put more burden on the heart, cause the heart to overwork. And before you know it, the heart can begin to get tired. So it's important for us to know this as well. Also, cigarette smoke contains a lot of carbon monoxide. Okay, and that reduces the blood's ability to carry oxygen, causing the heart to work harder. So the heart is working, it's pumping, but oxygen level reduces. And because oxygen level reduces, the person is not able to get enough oxygen into the system. And that on its own brings about a lot of issues. And then carbon monoxide also comes in. Carbon monoxide is toxic to the tissues. Very important for us to know. Okay, it raises triglycerides and lower good cholesterol. The last episode we talked, we dwelt so much on cholesterol, the saturated fat, trans saturated fats. We dealt on polyunsaturated fats and the rest. We looked at the good and the bad cholesterol. Cigarette smoking will increase the bad cholesterol and it will reduce the good cholesterol. It's important that we know that. And that on its own will also cause buildup of plaques in the body, build up of cholesterol in the body, and that can completely block the blood supply to the heart and cause heart attack. Not only cause heart attack, it can cause stroke. So smoking can cause stroke. Smoking can cause kidney problem, kidney damage. It can cause cancers, of course, we know, lung cancer, esophageal cancer, gastric cancer, and the rest, bladder cancer. So smoking can cause all of this. All right. It makes blood sticky, and more likely to clot, which can block blood flow to the heart and the brain. And that can cause, you know, uh, that can bring about stroke, heart attack, and the rest. These are things that we must, know about. It's very, very important for us, therefore, to be very intentional. Make sure that we avoid all forms of cigarette smoking. Now, somebody may ask, and I think I just saw a question in that regard. What of smoking, all this smoke fish, somebody's trying to roast something, roast this, roast that, and the fumes, the smoke that comes in, someone is inhaling it directly. How dangerous are they? They are dangerous. They may not have as many active substances as the cigarette smoke, but they activate, what we call some chemicals in our body. We'll call them cytokines, but I'm not going to bore you with that. They activate some chemicals in our body that can cause narrowing of the blood vessels as well, that can bring about increased, production of bad cholesterol, and eventually make sure that that person, instead of being able to have a very healthy blood vessel, that person begin to have clogs in the blood vessels. And that can also lead to, stroke, heart attacks, and the rest. Not only that, it can directly affect the lungs. All right. There's what we call, inflation. Increased volume of the lungs. Okay. And obstruction of the lungs. So it can cause what we call COPD, chronic obstructive pulmonary disease. I'm not going to bore you with that, but it can make the lungs to become diseased, such that over time the person may need admission, and that is not what we will want for anyone. So it's extremely important that we know this, that cigarette smoking is not good for for anybody at all. All right, so let's go on. Effect of smoking in the body. We've looked at the fact that it can cause, almost all kinds of cancer, a lot of cancers. Okay, mental health problems. All right, there can be dementia eventually. Someone, the reasoning ability, um, um, you know, intelligence faculty, and all the rest damaged. and the person begins to behave in ways that is not aware of surroundings, behaving in so much some very very odd ways, and is not able to judge correctly. Judgment, the ability to judge things, the ability to take actions becomes greatly reduced. Okay, it increases the risk of heart attack and heart disease. We've talked about that. There can be vision loss, okay, and a lot of changes in the vision. It can predispose to cataract, predispose to glaucoma, increases gum disease risk, causes irreversible lung damage. We've talked about that. Fertility problems. Those who smoke are more likely to be infertile compared to those who do not. And then delayed wound healing. Okay, it increases, bone loss. It increases the risk of developing diabetes. That is also something that we need to know about. Let's go on. So, what happens to your body when you quit smoking? Or what happens when you decide to quit? Because we need to look at this. uh it's going to be very very brief so that we can cover everything. There are so many other things we can talk about with smoking and cardiovascular health. All right, so apart from these ones that we've talked about, it can predispose one to heart failure. All right, predisposes one to arrhythmia. That's abnormal heartbeats. Okay, very very important that we know that. So somebody who smokes can have palpitation. The heart will be beating very very fast or in a chaotic manner. It is possible for that to happen. And like I said, everything that I'm saying now that applies to primary smokers apply almost 100% to secondary smokers as well. So we need to be aware of this. Somebody is smoking beside you, please go as far away as possible from that person. Don't stay in the same room. If you can avoid it, leave that room. If you can avoid it, leave that car. Make sure people don't actively smoke around you, because it is not the best. And of course, for those who roast things, when I see those who make suya, who make smoked fish and the rest, I try to tell them, can you use face mask, please? Try to just protect yourself, because it is very, very important. While you are doing your job, you should not get, you should not invite infirmities to your body. You should not invite sicknesses to your body. And more often than not, these things don't come immediately. It's a long-term thing. All right, is a long-term thing, and we need to we need to educate people around us. We need to be our brothers and our sisters keepers. You see somebody who's so energetic, so very vibrant and passionate about what he's doing the smoke fish, tell that person, please, can you just use nose mask? That way, that it will help you. Yeah, they may say, if I use nose mask, my customers will not want to come. No, that's not true. A customer that is aware of, that is informed, will even, prefer that you are protecting yourself. And by using nose mask, if you talk, you are not, you are not directly releasing spittle, little drops of sputum into whatever it's been done. Yes, you can say that, the fire is going to roast it, but it becomes more healthy for the person and for the consumers as well. All right. So let us look at what happens when one stops smoking. So 20 minutes after, there's return, of heart rate. All right. And, return, sometimes of blood pressure. It can actually delay more than this. So 20 minutes is not sacrosanct. It can delay more than this. For quite a number of people, chronic smokers, some of these things don't return on time. But when somebody quits smoking, okay, from almost the first hour, things begin to reset. By the time the what we really want to stress on is the 1 year, the 5 year, the 10 years effect. By the time you stop smoking consistently, and you say no to the urge, all right, your body begins to reset, your body begins to heal, things that have gone haywire in the body begins to get back to normal. So risk of dying from lung cancer is reduced by half by the time someone has stopped smoking for 10 years. Risk of coronary artery disease is reduced by half by 1 year of quitting smoking. Coronary artery disease is, the pathway to heart attack. And a person who comes down with coronary artery disease is likely going to have, some things going on in the brain as well. Can come down with, blockage to the, blood supply to the brain. Can have ischemic stroke. So it is extremely important that, by 1 year of quitting smoking, you have reduced the risk of coming down with coronary artery disease. That's, heart problem by half. By 5 years, stroke is the same as a non-smoker. So by 5 years of quitting smoking, the risk of developing stroke is completely, eradicated, completely removed, becomes like that, like someone who has never smoked, like a non-smoker. That is very, very heartwarming. Okay, that is a ray of hope to those who say, oh, I want to stop smoking. There are a lot of gains to it. All right, and that by 10 years the risk of dying from lung cancer is reduced by half. Of course, the earlier the smoking is stopped, the better. Because if somebody has already come down with a cancer, now it is not the risk of developing cancer that will be reduced or erased. We will now begin to talk about of managing the cancer. If somebody comes down with coronary artery disease or heart attack before quitting smoking, we won't be talking about the risk of coronary artery disease being reduced anymore. We'll be talking about managing that person, treating that thing that the person, has been afflicted with, unfortunately so. So it is important that, we do that. Primary and secondary smoking, very, very essential that, it be stopped. And if you have friends, we have colleagues at work, we have family relations who smoke, try and educate them. You can send them this, recording after the whole episode and then engage with them again. Some people actually want to stop. It's difficult to stop. All right, but it is possible. Okay, very, very important. So when smoking is stopped again, 1 year after, the risk of cardiovascular disease, coronary artery disease, is half for a smoker. Between 5 to 15 years, stroke is reduced to that of a non-smoker. And the risk of coronary artery disease is that of someone who never smoked after 15 years. There is benefit in quitting. And the earlier it is done, the better for the person. Very, very important. So let's look at the STAR method for patient preparation to quit. Okay, set a quit date. Very important. Ideally, the quit date should be within 2 weeks. While you are still passionate, while you are still burdened about the problems, the challenges of smoking, and you're like, I got to get rid of this. In fact, the earlier the date is set, the better. All right. And once you set the date, try to get people who you can be accountable to. Tell family, friends, and co-workers about quitting and request understanding and support. Very important. So S, we say is STAR. All right. And for anyone who successfully stops smoking, that person, as far as cardiovascular health is concerned, pulmonary health is concerned, we say that that person is a star, because it is very, very challenging to stop. Some people stop and go back, stop and go back. So tell the person, tell friends, family members, co-workers, get people who you can be accountable to. Also help patients obtain extra treatment, social support from self-help groups if available. Anticipate challenges to planned quit attempt. There will be challenges. There will be cravings. All right. There will be serious, intense cravings with its own, with its own attendant features. Okay, it comes. It's usually there, particularly in the critical first few weeks. The person will feel like smoking. There will be withdrawal symptoms. All right, the heart may begin to race very fast. Sometimes the person may become very nervous, very agitated, and things like that. But those challenges should be discussed with professionals, those who can help. All right, and of course you can have confidence that you can share with, this is what I'm going through, this is what I'm going through, and that will help. Remove tobacco products from the environment. Anything that may be like, a replica, a similitude, that have the similitude of cigarette smoke, of tobacco smoke, shisha, and all the rest. All right, heroin and all those stuffs, remove them from sight. All right, and it also something we need to do even with our phones, because sometimes you see ads just pop up of one guy that poses like a superstar and just blows it. Remove all of those immediately. So remove tobacco products from the environment, from your area of operation. Prior to quitting, avoid smoking in places where most of the time is spent. So at work, at home, and in the car, avoid them as much as possible. All right. And then join a support group. Extremely important. Number one, join a support group. Okay. The support group can help you to, you know, together help you to overcome the urge to go back, the challenges that will come, the cravings that will come back, the withdrawal symptoms, and the rest. People will be able to share with you their own experiences when they went on that journey. Overcome the urge. Okay, distract yourself from the urge of going to smoke again. So instead of smoking, you can decide to exercise, eat the gym. Okay, you know breathe fast, drink water, just overcome the urge, all right, by doing something else. Okay, manage your cravings. The cravings will come. Get enough sleep. Okay, get enough sleep. Do physical activities, take water, take fruits, take things that will be beneficial to your health. All right, and then number four, get new habits. So instead of smoking on the road and go, you can, get new habits of, jogging, of, snacking, healthy snacks as you move around. Okay, in the car, put healthy snacks there. While the craving is there, just, put something in your mouth and remind yourself, I am, I am not a smoker. I have quitted, and that is for all. That is it. All right. Do things that will, reinforce your resolve to stop smoking. And I'm sure that that will help, And if you know anybody who is battling with it, you can, direct them to us. We will be able to, help them out. And I'm sure that together with such people, we will conquer the craving for smoking. All right. Alcohol and heart disease. Smoking and alcohol, they are almost twins. All right. And in this one, I know that there are, a lot of controversies, a lot of work, a lot of things that have gone in. And before I even go into it, I know that somebody will ask that, but they said that a little alcohol is good for your body. This and that. What about the French paradox? What about red wine and all the rest? We'll try to answer them, with the time that we have. All right. And then, we will get into discussion. So alcohol and heart disease. Okay, alcohol directly affects the heart. We need to know that. And yes, there are findings about some benefits of alcohol to health, so to speak. Some people have had research done and found out that, those especially red wine, Those who take red wine, tend to live longer than those who take other alcohol. And in some, in some measures, those who take very small amount tends to, have a bit of, better indices of health like cholesterol and the rest, all right, compared with some who do not. But let me tell us that this, have their own controversial results. Some of these things that have been passed to us, some of them have been debunked. All right. So, for example, the popular red wine. Okay, red wine. The reason why red wine is somewhat beneficial, so to speak, appears to be good is because of the antioxidants there. Okay, the antioxidants there, and those are that antioxidant is resveratrol. Okay, is also found in fruits. Of course, if you know what antioxidants in fruits, we talked about it. I think that was in the first session of tips to a healthy heart. All right, what we eat. We talked about the fact that fruits have a lot of antioxidants and they can help to reduce, bad cholesterol, increase good cholesterol. The same, one of the same active ingredients in berries is found in red wine. So it will only come to, to perform its own activities, all right, increasing HDL, that's high density lipoprotein, that's the good cholesterol, and reducing low density lipoprotein, that's the bad cholesterol. But it's also been found out that a lot of sometimes this does not happen, especially if the people concerned have other comorbidities. So somebody who drinks alcohol and is also a smoker, the HDL is not likely going to improve like somebody who is not. Somebody who, the LDL, the bad cholesterol, is likely to keep going up. Okay, so it's extremely important that we put this into very good balance. Very, very important. Not only that, it's been found out that those who take, red wine tend to have a bit of, better awareness of their health, and they do other health promoting activities. They take fruits, they jog, they are not sedentary. Later studies that came out. But those who are sedentary, those who don't do anything, the risk is very, very high. The risk of cardiovascular disease, cardiovascular related death, and all the rest is very, very high in them. And then finally, when it comes to, red wine and, whether it's beneficial or not, a study was done in which there were three groups: those who do not take alcohol at all, those who take red wine, and those who take, wine that the antioxidant, what makes it red wine, was removed completely from them. And that was what they were taking. They were taking red wine that has been, completely removed. Okay, and then there was another group that the alcohol in the red wine was removed, only the antioxidants, were given to them to take. Those who fared best amongst those groups were those who took the antioxidants alone, that the alcohol content in the red wine had been removed. Same red wine, but they removed the alcohol in it and then preserved the antioxidants alone and gave it to those people to take. Their indices far, far better than those who took red wine, as in red wine, the way they are, and the ones that feared, was amongst them all were those who took the alcohol alone without the, the components of red wine. What makes red wine? What does that tell us? Red wine, the conclusion of that study was that red wine on its own derives its benefit from the antioxidant and not necessarily from the alcohol. That in fact, the positive benefit is weakened, reduced by the alcohol content. So, these are facts. The world is a global village. You can Google, you can type it, you will see these things there. So, having said that, let us, let's move on. Okay. Excessive alcohol use can lead to certain forms of cancer, can weaken immune system, can affect mental health. So those who drink alcohol and things like that, they can come down with dementia. All right, just the same way. I mean, those who smoke can come down with dementia. Very, very important for us to know. And then it can increase blood pressure. When we talk, when we um, talked about your blood pressure, hypertension. Let's talk about hypertension. Okay, part one, two, three, four. We one of the risk factors for hypertension. For those who were there for that session, for those sessions, you remember that alcohol was one of the risk factors, and of course, alcohol is also a risk factor for heart disease. Okay, and of course, there can be alcohol use disorder. So, how alcohol can affect heart health? Number one, it can cause tachycardia. Tachycardia just means that fast heartbeats. All right, so the person's heart is fast, is racing, and sometimes patients will complain and say, "Oh, they are feeling their heartbeat as if their heart wants to jump out, as if the heart wants to jump out." Okay, so tachycardia is there. Atrial fibrillation are all forms of arrhythmia, really. Arrhythmia means abnormal heartbeat. So instead of the heart beating regularly, sometimes there can be premature beats, there can be abnormal beats, instead of, the lobbed up, the person's heart can miss a skip. So instead of this, the person's heart can be, but for atrial fibrillation, there's complete chaos. The heart is completely, um, the heart is completely irregular. Okay, very, very important for us to note that the heart is completely irregular. It's just beating in a chaotic manner, in a chaotic fashion. All right, and that can predispose to sudden death, that can predispose to stroke, that can predispose to a lot of problems in the body. And then there can be increased blood pressure, and then there can be cardiomyopathy. Cardiomyopathy just means heart muscle disease. Now, some the postulation that a little wine, small portion will is beneficial and cool. We've talked about that. But then atrial fibrillation has been found out that, in atrial fibrillation, it's been found out that no amount of alcohol is beneficial. No matter how small it is, it can predispose the person to atrial fibrillation. So the relationship between atrial fibrillation, that is abnormal heartbeat, and alcohol is linear. The smaller it is, the smaller the risk, but there is still risk. The higher the alcohol, the higher the risk. So it is something that we need to be aware of. It's not Everything is not about good cholesterol and bad cholesterol. No. Also, cardiomyopathy, heart muscle disease. There's no amount of alcohol that can make the heart to get stronger. Alcohol will only damage the heart, will only make the heart weak. So we need to be aware of that also, and take informed decisions. Okay, so direct. So when we talk of direct toxic effect of the heart, we've talked of atrial fibrillation, we've talked about hypertension. There can be malnutrition, okay, or what we call beriberi. I'm sure in biology we still remember beriberi. There can be zinc deficiency. With zinc deficiency, a lot of things can come in. There can be reduced, immunity. The person is predisposed to diabetes. The person is predisposed to, a lot of issues. And then alcoholic cardiomyopathy can come in, like we said. And a lot of these things, in a lot of these things, there are what we call genetic interplay. So somebody may ask the question and say, "Oh, the father, or the uncle. Oh, I know a uncle. one of my own, and I know an uncle that, just, I mean, it's just like a factory. He used to, he drinks. He's still alive. He's 90. He's 90 years old and he still drinks. What about that person? The genetic, wiring of that person may be different from somebody else. All right. So these things happen even in smoking. There are some people who have, genetic makeup that helps them to quickly break down the toxic effect of cigarette smoking. But it's not everybody that have it, that has it rather. Not everybody. And of course, not majority of people, just very, very few people that have such things. And we cannot base our conclusion or generality on just a few people who may enjoy what I will call few graces, few benefits, so to speak. All right. So alcohol, genetic interplay is very important. Social interplay, social structure, I mean, indices is also very, very important. So those who are, poor, lack of social support, and the rest who drink, of course, that when they come down with any of the illnesses, they are the ones that will bear more of the brunt. Okay, and then of course the diet. Somebody who is taking alcohol and is also taking fried things, taking all sorts of pastries and all the things we talked about in the last session. Of course, that the outcome for that person is likely going to be worse than somebody who takes a little of alcohol but does work out, jogs, takes plenty of fruit, takes plenty of vegetables, avoids saturated fats and the rest. His outcome or our outcome will be better. And of course, smoking um, and alcohol, they are two deadly twins that can destroy anything. Very important for us to know. And poly substance. Some people add all sorts of things to their alcohol, lead, this one, that one, psychoactive, ingredients. All of these things make it more, injurious to the body. Now let's quickly talk about holiday art. Oh wow! I'm going to round up now so that we'll have time for interaction. So holiday heart syndrome, paroxysmal atrial fibrillation. So that's chaotic heartbeat, very irregular heartbeat, and usually takes place when people have binge drinks. Usually binge drinks, but science have found out. We found out that even those who don't have binge drinks sometimes come down with a smaller version, a milder version of holiday heart syndrome. So this person, go for outing, goes for a party, and then drinks very heavily. And before you know, the person finds out that he begins to have palpitation. The heart is beating very irregularly. The person becomes fatigued. The person is dizzy, and then complains of shortness of breath. That is holiday heart syndrome. And for some people, it doesn't have to be binge drinks, even very small amount. They have very little expression of this. All right. 10 healthy things that happen when you stop drinking. I'm going to quickly rush through this so that we can ask questions. Number one, there's improved sleep quality, there's enhanced mental clarity and focus, there's increased energy level, there's reduction in calorie intake. Those who drink alcohol tends to get, the tendency to be obese is higher in those who drink alcohol, because while they are taking the alcohol, they are taking their fries, they are taking this, they are taking that. Of course, they sit down for hours gisting and talking. That is a form of sedentary lifestyle, okay, and that increases their BMI, their body mass index. We talked about body mass index and how to calculate it. It improves immune system function, better digestion and gut health, healthier skin, improves heart health. Of course, we've talked about that. Positive lifestyle changes and greater sense of well-being and self-control. Very important for us to know. So let's stop here for now. Sorry, I think I've eaten into our interaction session, but we're going to quickly go into it now. Let's stop here for today. Thanks for listening. God bless you. So I guess there may be some questions in the chat box, and I think that And some of our doctors must have, responded to some of them. I think Dr. Doi, I'm not sure Dr. Bailey is around. I know she has something to do um, today, but I know that some of the questions have been answered. But if you have questions that you have not penned down and you want to quickly ask, please raise up your electronic hand so that you can be given the opportunity. But before then, I would like to welcome Dr. Donye to just say one or two things to what we have discussed. And then, kindly help me unmute Dr. Yinka Shitu as well. He's a consultant, emergency medicine, physician specialist. He works in Australia. So please, you can help me unmute him. Just look out for him in Kashitu. You can unmute him as well so that I can say one or two things before we start here, listening to the questions. Yeah, Dr. Adoye, please, you can quickly say something.
Good evening, sir, and good evening to the house. I think everything has been well put together today, but just to add a few. There's a question in the chat box which I answered just to actually give more a robust reason to why we should desist from e-cigarette. Somebody was asking about e-cigarette or the vape. Basically, it has much risk, if not much higher than cigarette itself. And I've even found a few videos whereby those who keep those e-cigarettes in their pocket, it could actually ignite and could set them ablaze. I've seen people whose trousers were actually set ablaze by the e-cigarette in their pockets. So apart from cardiac health, it's even dangerous for the well-being generally, something that could just all of a sudden ignite fire. And the studies are suggesting that the effect of using e-cigarettes might even be much worse than just taking normal cigarettes. It could actually cause some form of accelerated atherosclerosis. That basically means that causing more injury to the vessels in the body. And like it's been said earlier on, when we have more injuries to the vessels inside the body, we are more susceptible to having a heart attack, and not just heart attack alone. A stroke can also be around the corner, basically. So just to summarize everything we've heard today, we need to actually find ways of running away from alcohol, cigarettes, and also from alcohol. And some people are of the opinion that, oh, I don't take red wine. It's spirit that I take. The average red wine tends to contain about 10 to 14% alcohol. When you get the bottle and look at the detail, you see 10 to 14% written on it. Why the spirits, the vodka and the rest of them, the Chelsea and the rest of them, from like 20 to 40% alcohol. So you can imagine the strength of what we're taking in. So apart from hampering the heart, as it were, it could also affect the liver. So these are a few things I have to say. Thank you.
Okay, thank you very much, Dr. Don. Dr. Inkashitu, can you just quickly?
Yeah,
you're welcome. Thanks for joining us.
Oh, yeah, thank you very much, Dr. Olusegun Joseph. Thanks for the opportunity, and thank you everyone present tonight. It's a very good thing to, be talking and discussing this topic, and just buttressing what my colleague just talked about with e-cigarette and vaping. I think the challenges is something that people are not clued on to the amount of damage that they can do and cause. And what we're beginning to see now is people presenting with a lot of symptoms of wheezing, and they're being diagnosed with you see a lot of new diagnoses of asthma.
Yes.
And there's the gap there is that we're forgetting to actually ask whether these patients are being exposed to e-cigarette or vaping. So it's one area that we as clinicians need to be very, very conscious and have an awareness of. The only other challenge is that how do we prevent this? It's already becoming a big problem in the developed world, Australia, where I practice, and it's a big problem in the United States. and United Kingdom. And the government, they are trying to develop policy on how to manage it, because you see very young people, picking up vaping, and the market is also not as licensed, and the warning advertisement is not as very pronounced as the one that you have for cigarette smoking. We have to understand that it's also very addictive. People feel because it's not cigarette that they don't get addicted to it, but it's nicotine that's being released at very high pressure, and it causes extensive lung damage. And also it causes all the problem that you see with cigarettes. The thing that's not been yet established because of this, it's not been it's a new recent way of exposing the body to nicotine, is the long-term cancer rates that can be. So it's probably going to take a few more years, or maybe in a few more decades, to be able to see whether it also have that effect. But everything else that cigarettes can cause, with regards to cardiovascular ill effects, we're already seeing it. But more importantly, the respiratory effect of it. So I think it's one thing that I think we clinicians needs to be very much aware of. Thank you for the opportunity to share.
Thank you very much, Dr. Inkashitu. Highly appreciated. Yeah, please, if you have questions, comments, you can raise your electronic hand so that we can quickly attend to the questions. It's 1 minute to 8. We plan to make it 1 hour, but please, if you don't mind, we can in just a few minutes to quickly answer the questions that people may have. If you have questions, please raise your electronic hand, and then you will be given the opportunity to unmute and ask your questions. Anybody with a question or questions? I think the questions in the chat box have been answered, I hope. Okay, is it advisable for a hypertensive diabetic patient to take Irish cream? That's from Dr. Mustafa. Thank you, Dr. Mustafa. Dr. Inkashitu, I know Irish, cream is something that is more in your side. So you want to answer this for us? You want to help us out?
Well, there's no different. Irish cream is an alcohol basis. It's whiskey with some cream in it with some. So and I think it's also very. I mean, most Irish cream will be have 45%, or that kind amount of alcohol in it. So the problem with Irish cream is, because it's got a sweet taste. People don't often feel that they're drinking, and sometimes they may even overdo it, getting yeah. So it carries as much as the same risk as consuming other form of alcohol. Yeah. So there's
Yeah, thank you very much, Dr. Then you have actually even penned it down in the chat box. Thank you very much. So, Dr. Mustafa, I hope that clears your curiosity or your question. Is yogurt good for an hypertensive person? Dr. Daye, you want to help us out?
Well, I think I'm not too sure it has anything that should actually be of so much concern to hypertensive, rather maybe to diabetic patient, basically. But at the same time, whatever it is we take should be with moderate proportion, basically. So once in a while, but it might actually have unsaturated, saturated fatty acid, I guess. But maybe once in a while it might not be bad, but it shouldn't be frequent, basically.
Okay, thank you very much. So the issue with yogurt is the sauce and the contents, really. Greek yogurt, quite nice, all right? Very low in saturated fats, and then, low in sugar, in refined sugar. But then we know that the yogurts around us here, okay, and in most places are sweetened yogurts that already have a lot of sugary contents. Okay, so that is an issue. Sugar can raise the blood sugar. Sugar, has pro-inflammatory properties. Okay, can cause subclinical inflammation. Can increase and improve subclinical inflammation. So that is there, and then the saturated fats in it. So if it's Greek yogurt, nicely prepared without sugar in it, without any of the saturated fats, fine, that's good. It's healthy. But then if it's the other yogurts that they put a lot of cream and a lot of saturated stuffs and a lot of sugar just to make sure it's very very appealing to the taste bud, that may not be as good as healthy yogurts will be. Okay, I hope that answers your question. What is the correlation with heart disease and diabetes? Uh, we've talked about diabetes before. We've not really delved into it. We're still going to have a session for it. So, because of our time, if you don't mind, sir, okay, bye bye. Yeah, if you don't mind, sir, let's reserve it for the time we're going to take diabetes. But then, diabetes is a major issue when it comes to heart problem. It can cause arrhythmia. That's abnormal heartbeat. It can cause stroke. It can, predispose to heart attack, can predispose to heart failure, it can cause heart muscle disease, name it, all forms of things. Diabetes, it's as far as I'm concerned, is more deadly than hypertension. It's a very, very horrible, disease. Okay, if it's not well managed. All right. Dr. Shitty, do you want to say something about that? Is it okay?
Diabetes,
Yeah,
about diabetes.
yeah,
Yes, diabetes is a disease that affects every part of the human body, in a negative way if it's not controlled. And
yeah.
we have to understand that diabetes are two types. There is the primary diabetes where it's usually uh, a complete inability of the body to secrete the insulin, as well as the secondary type, which sometimes lifestyle can play a part. We also know that genetics also have things to do with diabetes, but the
Yeah.
issue with diabetes, if it's not controlled, then it affects both the very very tiny vessels as well as the big vessels in the body. So there'll be
Okay,
problem
sorry.
with the
So let me
kidneys.
just halt you. Sorry.
Yeah,
Sorry. Let me just halt you. About
yeah.
that. Since that's not what we're really dealing with, I think, what we have said is okay. Just take the next question. Is there
Yes.
no benefit? I can see somebody who is like, let me hear something good about alcohol. Is there
All right.
no benefit, no any benefit in taking alcohol at all? Do you want
Well,
to
I don't.
answer that?
Yeah, I can answer. No, I wouldn't say there's no benefits. You see, everything is if it's done in moderation, is when everything is done to excess that it becomes a problem. So,
Yeah.
you know, the alcohol itself, is used for different things. It's a preservative. Sometimes it's also it could be used in making certain meals. There are meals, especially European, most of the European cuisine where wines are used in part of the cooking process. So it's not it's when we now use over fermented, alcohol, highly concentrated alcohol over a prolonged period repeatedly. This is when alcohol becomes a problem. Um, i- so we shouldn't just completely throw it away. That you know, uh, there should be complete abstinence, from alcohol. Uh, uh, the advice would be, if alcohol needs to be consumed, it has to be in moderation. So I wouldn't say there's not any benefit. So like I said, it could be preservative. It's also it's antiseptic, and it's used to bring out the taste of food in the cooking process. So it's not completely it is wrong to say that it doesn't have any benefits. Yeah.
Yeah, so thank you for that. Alcohol, yes, I mean, even if you look at what I've said, I mean, alcohol can increase HDL, can increase, it has been found to increase HDL, reduce LDL. But then when it comes to heart health, you've got to be very, very careful. I mean, as preservative, yes. I mean, even methylated spirits and things like that, purification and co gets things, I mean, sorted out. There are benefits of alcohol. Ingesting it can be dangerous to your health. All right. Yes, I mean, in moderation. And then the issue is, what is moderation? That's one. Two, um, American Heart Association, I mean, World Heart Federation will tell you, you cannot tell somebody, oh, start taking alcohol because of the benefit. No, it's not going to work. Nobody is, advised to tell anybody that. But you know, you've got to just know that there is a balance. And many a times, this thing, I mean, we're already battling with a lot of things. So many a times, this thing can actually, come in the way of one's health. Very, very important for us to know. Thank you, Dr. Shitu, for that, I mean, stuff. Um, I'm not sure there's any other. Okay, let's quickly. Host, can you kindly help me unmute? We need to go. This is 10 minutes, almost 10 minutes after. But help me unmute Adetono. Mr. Jide, I don't know whether we can take your question, but if Madam Tino Adetono is able to make her own very brief, then maybe we'll take yours. Please go ahead.
Hello, good
Please go
evening,
ahead.
sir.
Good evening, ma.
Yes, sir. Please, I want to know what is the meaning of grade 1 diastolic dysfunction.
Dysfunction.
Dysfunction. Dysfunction.
Dysfunction. Okay, it's not part of the discussion of the day. So can I just say that maybe you just hold on while let's hear question of the day. We can attend to you, okay? But please let's give room
I went to visit a friend in the hospital today, and I read it in her card. So I'm just anxious to know the meaning.
Curious.
Yes.
Okay, Dr. Donye, so that you won't say I didn't answer your question. Dr. Donye.
Okay, just in a simple way of answering the question, just there's a way the heart relaxes to receive blood. Okay, so it's graded like 1, 2, 3 as it were. So with age, sometimes your heart may lose that ability a little to receive so much blood usually, and that is this condition that can also make the heart not to have such ability to relax enough to receive. So it's like if you're folding your hand, you won't be able to receive, so to speak, kind of. So it depends on what the condition is. If it's grade 1, it may just be age related, as it were, like that, or hypertension sometimes. It's something you can still live with and you can live a normal life if it's just grade 1. But if it starts to move from 2 to 3 and 4, as it were, like that, then there could be issues. But there are things that could be done to give us some respite.
Okay, sir.
All right. Thank you, man. So it's just reduced relaxation or impaired relaxation of the heart. So the heart relaxes to get blood and then now pumps the blood out. That ability to relax and get blood becomes a bit compromised. That's grade 1 diastolic dysfunction. All right. I think Mr. Jide has decided
Another question, sir. I want it's not a question per se. I want to know whether any of your clinic is around Ogba area, Ogba Agege. Because the one any of the clinics that is nearer to Ogba or Agege.
Okay, for now we are not there.
Sometime was Surulere, which is very far.
Yeah, for now we're in Surulere, but we'll get there. We'll come to you.
Sir. Okay, sir.
If you get us a place, we can come. No problem.
Okay, sir. Okay, sir.
We'll come to you, no problem. But for now, we're in Surulere.
Okay, sir.
All right, man.
Thank you, sir.
You're welcome, man. There's quite a number of things in the chat box now. I've advocated for all our webinars to put in on Telegram platforms. So yeah, there are. We'll share the link with you. There is we're putting them on Telegram, and they're also on YouTube and Facebook. So after the whole thing, the links will be shared on the WhatsApp page. Thanks so much. I believe in my mind that diabetes and hypertension are brothers and sisters, and they work together sometimes. Yeah, you're correct. How can we get the recording? We'll post it to the platform after the meeting, maybe later today or tomorrow once it's available to us. Please, what are the early symptoms of heart problems? We have discussed that before. We'll send the earlier recordings to us as well. You can pick that up. The recorded version, okay, that's good. What are the symptoms of the early symptoms of heart problems? We talked about that before. Palpitation, the awareness of your heartbeat, cough, difficulty in breathing, and quite a number of other ones. We've dealt with that before, so we'll send the recording to you. All right. Thank you very much. I hope we have answered all the questions. I can't see the hand of Mr. Jide again. So I want to believe that maybe your question have been answered, or you want to reserve it for us to save our time. I must say thank you to everybody. I hope we have answered all the questions. I must say thank you to everybody. We really, really appreciate you. And for staying till this time, we really, really appreciate you. Thank you, Dr. Donye. We can't thank you enough. Okay, somebody said Hollandia yogurt. Oh, well, Hollandia yogurt, as far as I know that it has a bit of saturated fats and some sugar. Not that it's altogether bad, but if you're going to take it in, just moderation, little quantity, because the sugar is there actually. I know Hollandia yogurt. There's sugar there and a bit of saturated fats. Okay. Greek yogurt is still one of the very best, really. Okay, and Greek yogurt without sweetener. Okay, that's good. But life should not be boring. If you want to if you buy the sweetened one, okay, just consume it. Reasonably. That's it. I hope that answers the question. Yeah. So thank you very much, everyone. We really, really appreciate you. Thank you, Dr.